Good morning. So it's almost lunchtime, and you're hungry. You're thinking, I'm craving a hamburger. So let me think about what the options. With the technology that's available these days, you take out your smartphone, you find your favorite restaurant app, you browse through the menu, you tap on what you want, and off you are, you're driving to your favorite fast food place. In the meantime, in the background, the GPS technology is tracking your every location. Might be a little bit scary. However, upon arrival, your order is ready for pickup as a result of all of these actions and steps and features. We take these advantages of the technologies for granted every single day, but in reality, what we want to do is harness it for the most time sensitive, life saving treatments that are out there in healthcare. And so, with the technology and the trove of data that's available, ultimately the goal is we want to mobilize our teams, the parallel processing that might occur in the background at the restaurant, and deliver a positive, quick, efficient customer service experience each and every time. So, you might ask yourself, what does this have to do with acute stroke care? The answer, as I alluded to, is everything. Time is brain, and as you'll see with our journey in South Florida over the last few years, we can make a dramatic difference by empowering the paramedics and the communities and the healthcare systems with the technologies and the data. So a stroke occurs due to a blood clot that gets dislodged from the heart or the neck and blocks major arteries in the brain. Seconds and minutes are of essence. Every minute that lapses until these clots are removed, millions of neurons, approximately 2 million neurons, are at risk for irreversible damage. So you can imagine a patient or an individual, a loved one, that is walking and talking, living meaningful quality of life 1 minute, and split next second, they're completely paralyzed, unable to get any words out, unable to understand what you're saying to them. These are what we define as the most severe strokes. In our field, we define them as the large vessel occlusions, or LVO. Okay? These strokes previously could not be managed effectively in the hospital. There was nothing to be done. Patients were nursing home bound and loss of productivity to society. As my mentor once put it, it is like a wildfire spreading in the brain, and we have to put it out as quickly as possible. Unfortunately, we had nothing to offer. Up until 2015, all we were doing is medically managing these patients upon arrival in the ICU and then nursing home. The annual estimated costs as a result of the lack of effective treatments exceeded $70 billion. And not just hospital expenses, but nursing home care, and most importantly, loss of productivity back to society. This treatment, called mechanical thrombectomy, after 10 years of research and development, finally was proven to be effective in successive publications in the New England Journal of Medicine. And it overnight became a standard of care. However, the challenge has been how to fully implement this treatment and make it available widely to every patient that needs it in a time-sensitive way. This treatment entails a procedure in the cath lab, introducing a catheter through arteries in the leg or the arms, and under image navigation, going to where the blood clot is, and using stents to simply remove the blood clot. Sounds a lot easier said than done, but believe me, I've seen it with my eyes. It's one of the most gratifying things available in the history of medicine. Based on the data, 1 out of every 2 patients have been shown to benefit from this treatment. Patients that are completely paralyzed on the table in the cath lab, 1 minute, as soon as a clot comes out, within 5-10 minutes, they're fully lifting their arms and legs, talking, and leaving the hospital within a couple of days instead of nursing home bound. It is now imperative that we get this treatment out to as many patients that can benefit. News agencies, other outlets have taken note. The Wall Street Journal example in 2018 chronicled the story of 2 patients, one that ended up at the right hospital in Atlanta, Georgia, another one at the wrong facility. And unfortunately, you can imagine the patient that received the treatment within the golden hour of stroke care ended up leaving the hospital without any neurological impairment within a few days. The other patient, unfortunately, was sent to a nursing home. So we asked ourselves as neurointerventionalists, what are the challenges that we face in our state? And it's important to understand how stroke is managed. When an individual is experiencing a stroke, you traditionally call 911 because they cannot get to the hospital by themselves. They can't drive them there. Family members, loved ones typically observe what's happening and they call 911. Unfortunately, these days, based on federal, state laws, paramedics are instructed to take patients to the closest facility, the stroke centers, rather than the best, most appropriate treatment facilities, what we call the comprehensive stroke centers. In the state of Florida, there have been a proliferation of these comprehensive stroke centers. It's no different than coffee houses around every corner. So you can imagine paramedics not having any idea where to bring these patients, and they might think they're helping, doing the right thing, taking them to the closest facility. Little do we know that stroke is just like trauma. That brain is dying every minute that elapses. We have to have a sense of urgency, treat stroke like a trauma patient bleeding out, and you can imagine having a trauma patient go to the wrong facility. We would find that unacceptable. They go always to a level 1 trauma center. A stroke patient should always go to a level 1 stroke center, which is a comprehensive stroke center. So the additional delays that are incurred is what is very little known to paramedics or to the community, what happens inside the walls of the hospital. Once a patient enters the hospital, there's a web of teams, multidisciplinary workflows, not everyone working in unison with each other, and ultimately that incurs delays. The median time to treatment for an acute stroke these days, despite this transformative treatment, is above 2 hours. Can you imagine a heart attack victim or a trauma patient taking 2 hours to get to the OR and be treated adequately? Absolutely not. So we asked ourselves in 2015, just at the cusp of this revolutionary treatment coming about, how can we change our stroke system of care here in South Florida? We created in the country at the time what was first of its kind, the South Florida EMS Stroke Coalition. So we brought together all of our fragmented EMS agencies in Broward, Palm Beach, Miami-Dade, together with the neurointerventional surgeons, the neurologists, the hospital administrators, and we decided to visit the stations on a quarterly basis, the paramedics, and train them to make them neurologists. Because at the end of the day, they were the most integral part of our system, and yet they had very little knowledge of how to assess a stroke patient. I was asked many times, Dr. Mehta, why are you going out to EMS stations? They had no idea why a surgeon is going out to an EMS station with donuts. And the explanation is very simple. What we take for granted these days that paramedics are just transporters, get patients from point A to point B, is no longer the case. They are the most important part of the spectrum of stroke care. And we took on recognition events. We linked them with the stroke survivors that they had brought into the hospital, completely paralyzed, debilitated, unable to get words out. And they were shocked at how important of a role they played in that patient's life. The next thing we did is we lent them a helping hand. We said, look, we understand all of this is new to you. We would like to train you. However, if you're encountering challenges, simply call us via FaceTime. We utilize these technologies every day to communicate with our loved ones. Why not use it when it matters most? Inside an ambulance, it's no different than telemedicine. It's the simplest form of communication, and within 2 minutes, we're able to put our eyes and ears on the patient, figure out what's happening, and guide them to the most appropriate treatment facility. And in parallel, we're able to activate our cath lab teams as a result of these technologies, such that we're on standby well before the ambulance even arrives to the emergency room, such that we're ready to take that patient on the stretcher, just like a trauma victim or heart attack patient, straight to the cath lab. Now, there are emerging technologies that will allow us to reduce these times even further. So we started in 2014 at about 2+ hours to treatment in the cath lab. Imagine every 30-minute delay that's incurred, the likelihood of a favorable outcome is reduced by about 20%. So every minute matters. Now we're consistently treating these patients within the golden hour of stroke care. Previously only a dozen patients per year, now about 120 patients per year. And experience matters, practice makes perfect. Not every stroke center is created equal. These technologies, just like the fast food example, is what is going to get us to the next level. EMS entering data on a smartphone app, immediately transmitting that information to the hospital, having imaging platform such that we have the information in the palm of our hands, whether it's day or night, and activating the cath lab and driving in. So ultimately, we realized that we're not alone. If we were struggling in our system to make these changes and the challenges that we encountered, other hospitals must be having the same issues. What we wanted to do was empower EMS with data such that they can make the right decision every time for the stroke patients. It's no different than Yelp reviews, trying to figure out what's the best restaurant you want to go to. Why should EMS not have better knowledge of going to the most appropriate treatment facilities? We partnered with the University of Miami. This was the first of its kind initiative in the country. Just this year, creating these dashboards such that EMS has better idea of time to treatment, time is brain, faster the treatment, better the outcome. We took our message to the state capitol in Tallahassee, meeting with senators, the policymakers this year, and we explained to them why this is of essence. When worldwide there are 2 to 3 million estimated stroke patients that could benefit from this treatment, why only 50,000 patients are being treated? And state of Florida is no different, other states are no different. Immediately after hearing our testimonials, they revamped the stroke protocols, the legislation, such that EMS now is more empowered, partnering with their local healthcare systems, using data to make decisions, and requiring stroke centers to achieve national certification. I want to close with the story of Noelia Gutierrez. She's a 28-year-old mother of 3. She came into our hospital completely comatose, but as a result of the work of the paramedics and the early activation of the cath lab teams, harnessing the technology and the data, we were able to get her treated within the golden hour of stroke care. Within 24 hours, she was up, walking and talking. Within 4 days, she was back to her family. So I want to thank the paramedics who've worked tirelessly to get us where we are today, and let this be an inspiration for stroke centers and healthcare systems everywhere that every patient deserves a chance. Thank you very much.